Have you or a loved one ever experienced medical gaslighting or just felt like you weren't seen and heard while trying to seek health care? Hi, I'm Shauna. I'm a family nurse practitioner, but unfortunately, I know from personal experience what it's like to navigate the healthcare system with autoimmune disease and other chronic illnesses, fibromyalgia, and other chronic pain conditions. Let's talk about it. To start, I remember having migraines as young as 4 and 5 years old. Around the age of 11 or 12 was my last actual pediatrician follow up that I can remember because we didn't have health insurance after that. And they noticed that my thyroid was a little bit enlarged, mentioned it to my parents to keep an eye on it, but didn't really mention a whole lot beyond that. And I also was having a lot of muscle, knee joint pain and back pain as an adolescent and a teen that, of course, we just kind of figured was growing pains. And then at the age of 20, I had my daughter, and everything really snowballed and fell apart. After having my daughter at 20, I suddenly started having a lot of pelvic pain and heaviness, that feeling at the end of pregnancy, if you've ever been pregnant, at the end of pregnancy where everything's stretching and it feels like a bowling ball is about to fall out of your pelvis and there's a lot of pressure. I would have that as well as cramps that were more like labor contractions the entire time. And of course, I mentioned this to a provider when I was working briefly for an OBGYN at the front desk, and she said it could be endometriosis. And at my mid 20s, was also diagnosed with hypothyroidism and put on levothyroxine, interstitial cystitis. I also started having more knee and back pain and was a nurse on the medical floor. So I chalked it up to, life demand at that point. And according to MRIs from way back then that I reviewed years later, already had degenerative disc disease all up and down my spine by my mid 20s. And then when my schedule, I changed to a day shift 12-hour schedule. I felt great for a month, and then I was back to sleeping my days and nights off away again, and I could barely function. So I was like, okay, well, maybe it's the 12-hour shifts. Maybe 12-hour shifts just aren't for me. So then I started working for hospice and was on more of a Monday through Friday kind of daytime hours kind of schedule, less than 8 hours, sometimes a little more, but usually less than 8 hours. And I felt fantastic for a month. And then I started sleeping my days off and the evenings when getting home from work, afternoons and evenings, I'd have to take a nap to function. And sometimes I'd take a nap and couldn't function still. I could sleep anywhere from 8, 10, 12, 16 hours and need a nap an hour later just to be able to sort laundry and put a load of laundry in the washing machine. I mean, it was beyond ridiculous. And then in January of 2015, at the age of 30, I had my first fibromyalgia flare. And the signs had kind of been there along and along, but that was the first time I had a real flare that I kind of sat back and went, whoa, something's wrong. And I had what I thought was a thorough lab workup done, went to a rheumatologist, and they ruled out all the other things.